When we talk about medical malpractice, we basically referring to the actions or inactions of a healthcare professional that leads to an injury or death to the patient. That in simple terms. So when the health professional fails to follow the protocols with which they offer their services, and that failure leads to an injury or to a death of the patient, then we see that has occurred. In terms of statistics, we really don't have any survey conducted, so to speak. But then, on top of my head, because of what we do, I can only say that it's quite prevalent. But then, I can't have any empirical evidence because I don't know of any scientific study that has been done.
Okay, so let me rephrase that question.
Space, yeah.
Your office, for example, that is championing this, that is helping people who unfortunately might have gone for some health, care and have become disfigured, maimed, or lost. There's a family member who's lost a life and all that. If you look at your office, how many cases would you say, for example, you have in a day or a week or a month?
Well, so in terms of number of cases that will pass through the office, on a daily basis, we can talk about, hearing of 10 stories. 10. Yeah.
Daily?
Yes, in the minimum, because we work across the country. So we have calls coming in from all angles. But then the point is, for us to be able to establish a prima facie case, to really determine whether or not medical malpractice has actually occurred. Because it's quite a complicated matter. You just don't sit down and then place liability on people. You need to conduct a lot of painstaking investigations to really unravel the actual cause of whatever the person might have suffered from. And most of the times, because of lack of knowledge in this space or in this area of healthcare provision, the information that the patients give might not be that accurate to enable you even follow up and then make a determination. And again, if you are even able to get the accurate information, the hospitals or the facilities would also be running away. Not ready to collaborate with whatever or corroborate the story.
Why?
Well, everybody wants to run away from liability. If they think something has gone untoward, and so that's one of the problems, because you can't really get people coming out to admit that we are in the wrong. And for that matter, we want to make amends and then ensure that there's peace or
and I'm sure
a way for the patient to get some sort of compensation.
I'm sure I would even be right in saying that because we as patients who go to some of these medical facilities don't even know what constitutes medical negligence. Some of the times the facilities might have done something wrong, but we don't even know about it. We don't know about our rights and what is available for us, so we just let it slide.
That is mostly what happens, but I think you can't also blame the patient that much because of our cultural settings, how we are brought up. Ghanaians naturally are people who fear a lot. Coming out to even speak against what has happened is a problem. There have been instances where people have brought out issues, that they suspect to have been occasioned as a result of medical negligence or medical malpractice. And then somebody else will come and say, oh, so once that issue comes in, then you realize that you are really in for a loss, because obviously the person that you want to work for is not prepared to go that length.
But if you have cases like 10 or more in a day,
well, so
what does that say of